If you have ever wondered, how am I this smart and I am still disorganized? You might not actually be bad at adulting. You may have ADHD, attention deficit hyperactivity disorder. How do you go ahead and finally get a diagnosis after all this time? I'm here to tell you today. For a lot of adults, ADHD symptoms are not a flaw. In fact, they're just what undiagnosed ADHD looks like. It can look like constantly running late, no matter how hard you try, starting 10 projects and finishing none, needing chaos or last minute pressure to get anything done or get places on time, or just feeling too much emotionally and then crashing in shame afterward. You're not alone. Research shows that nearly 6% of adults have ADHD, but fewer than 1 in 5 are going to get proper treatment and a proper diagnosis. And if you're a woman, the odds are even worse. Many people go undiagnosed through life, but you deserve a proper diagnosis. Now, while I can't diagnose you through the screen, this video is not necessarily medical advice, but in recognizing the truth about yourself, you're finally going to get the information you deserve. So first and foremost, instead of spiraling to another ADHD TikTok or is this me video, take time to find a qualified professional, someone who can treat and diagnose. Now, here in the States, this could be anyone from a therapist to a psychologist or a physician. That's right. So these folks are going to be trained and qualified. If they are versed in ADHD, I want to be really clear about this. Here in the States, while social workers and therapists can actually do clinical diagnosis, you want to make sure it's someone who is well versed in ADHD, especially if you are someone with high IQ levels or intelligence or masking behaviors, which is also very common with ADHD because of the superpowers that it possesses. It can be overlooked and it can be seen as, well, you're doing well in all these other areas, so you can't have ADHD. It's just not the case. So finding someone who's passionate about this and making sure it's in their wheelhouse is step number one. If you are not in the States, however, for example, many of the students I teach are in Canada or other countries, you're going to probably want to be finding a medical professional, such as an MD or a psychiatrist, to be doing these diagnostics. Now, I know in those cases, it can take months to land a diagnosis and proper treatment, which can be really tricky and really tough. From there, you're going to be sitting down with them to be doing a series of different tests. So you've got your provider, you've chosen someone. Step 2 is you're going to be doing an initial assessment with them. For some folks, this can look like a brief history, but my hope is that you find someone who is willing to do a full extensive history with you. It's important to learn all the ins and outs. What this showed up like in your early childhood life, has it developed further in your adult life? Has it changed as your hormones have changed if you're a woman? All things to consider. After that history taking, you're probably going to do a series of different questionnaires. As an adult, you're going to be answering a lot of these on your own. If you've had a child that's been diagnosed, you often see that you get sent home with some of these questionnaires to fill out on their behalf. With adults, it's typically going to be you answering it. However, I have diagnosed adults before who I've encouraged to take some of these scales home to their coworkers, to trusted friends or family if they want a wider lens. Some of the typical assessments that you might complete are the ASRS, which is the Adult ADHD Self-Report Scale. This is a really common screening tool for adults with ADHD symptoms, looking up things like careless mistakes, difficulty finishing projects, forgetfulness, and fidgeting. You can actually find it online and do it yourself as a good jump-off point. Another more comprehensive one that you might end up doing is the Conners Rating Scale. This is a well-known scale for both children and adults, and it helps identify symptoms that may be comorbid or happening with other different issues like anxiety or depression. It also helps you look up the severity of ADHD symptoms. It's a little bit longer, but not quite as extensive as some of the other scales you could do. There's also the Vanderbilt ADHD Diagnostic Parenting Scale, which you would do for your children, which you would likely not do for yourself. If you go to a provider that offers an extensive battery of testing, you may also do an FDA-cleared test called a QB test, which is the core ADHD symptom computer task that helps you with an infrared camera to track a person's movements. This test requires that the user respond to symbols on the screen and measure their ability to sustain attention and control impulses. Are you sustaining attention as I talk about all these assessments? You may also do the TOVA, which is a computer program that uses visuals and auditory stimuli to assess your attention and impulsivity right then and there. This can be done for both children and adults. No matter the test, make sure that whoever you're going to hears you out. There's an old saying that you had to see ADHD symptoms present in all areas of life, but what they're coming to find now is that some of the masking behaviors can hide some symptom presentation in areas of life, especially if you happen to have a special interest in that area. For example, if your work is highly stimulating and rewarding, you may not see as many of the symptoms come out there, whereas you may be seeing this in things like running a home or parenting or even in your relationships. Also, I want to make sure that you have a provider that helps you rule out other conditions. Things like anxiety, depression, and trauma can be often misunderstood and convolute the ADHD symptom presentation. So making sure you're getting a full battery is really important. Now let's, after this, confirm that your symptoms actually impair your life and see if the next steps you want to take are a medical path, perhaps medication, or behavioral or lifestyle changes, or homeopathic or naturopathic methods. There are so many different ways to treat and support your ADHD brain, and each and every one of you gets to make that unique choice. There's no one size fits all. One thing I would highly recommend, though, is if you feel like your ADHD is causing a complexity of issues in your life and you don't feel like your general practitioner won't do anything beyond just prescribing, it can always be helpful to have a well-versed therapist or a psychologist or psychiatrist in your corner who can champion for you and explore the different medication options. When it comes to medications, it's also not one size fits all because some people metabolize very quickly. So they'll need to take things like Adderall or Ritalin twice a day, or maybe perhaps an extended release. There's also been some newer medications that come out that you can take in the evening that don't kick in until the morning. So these medications can be really great for those who have a hard time rising and hitting the day with the ground running. Remember, however, if you do have addiction issues, it can also be helpful to talk to your provider about other options like SSRIs like Wellbutrin that can help increase focus but also address things like depression and also smoking cessation. Whatever the medication is that you choose, making sure that it continues to work for you is paramount. So if you feel like it's not doing the job, talk to your provider as soon as you can and make sure you're being heard. If medication is not the route you want to take, I talk quite a bit about natural things that you can do that increase dopamine, help organize your life, and help you harness your ADHD powers and your ability to focus and hyperfocus in ways that work for you. Making sure you have a good team, not just your providers, but also your spouse, your partner, your family, to be in your corner and champion that the life you create around you encourages your ADHD powers can be incredibly helpful as well. What I would never want for you, though, is to just try to medicate and white knuckle through ADHD symptoms in ways that you think are going to be sustainable for the day, such as medicating with pounds of coffee to get through tough things, when instead you could be looking at things that might be supporting your nervous system overall. While each ADHD brain is unique, each journey is unique, and I'm here for you for this journey. You can reach out anytime you want. My virtual door is always open. Not only am I here to answer questions on the tube, but also in my newsletter, also in my books and my podcast. This is something I care a lot about, guys. And I want to be a place where you can come ask the questions and I can give you your own unique answer as long as I know it. And you know what? If I don't, hypercuriosity is a great neurodiversity trait, but I'd be happy to send you in the right direction. So you deserve to go get your answers today. Take a little bit of what you learned today. Go get your answers and live your best ADHD powerful life you can.